In an era where cardiovascular disease remains one of the leading causes of mortality worldwide, a focus on preventative habits is more crucial than ever. Experts are increasingly advocating for lifestyle adjustments that address not just the physical heart, but also the myriad factors contributing to its well-being. From sufficient sun exposure to mindful eating, these practices offer a holistic pathway toward optimal heart health and overall wellness. Amid the buzz surrounding skincare and UV protection, the power of sunlight often goes unappreciated. Beyond promoting mood stability and mental health, sun exposure plays a vital role in cardiovascular well-being. Vitamin D, produced in response to sunlight, is a crucial element for maintaining healthy blood pressure and reducing arterial stiffness. The sun's rays can also help lower inflammation, a major risk factor for heart disease and stroke. Vitamin D's profound role in the body extends to regulating calcium and phosphate, which are essential for maintaining healthy bones and teeth. However, insufficient vitamin D may predispose individuals to an array of cardiovascular issues, including high blood pressure, endothelial dysfunction, and increased arterial calcification. For those living in regions with less sunlight, especially during the winter, supplementation becomes a key consideration. Vitamin D3, combined with vitamin K2, is often recommended as this combination directs calcium away from arteries and toward the bones, preventing calcification and maintaining vascular health. Individuals are encouraged to aim for 15 to 30 minutes of sun exposure daily, preferably during the early morning or late afternoon, to balance the benefits with potential skin health risks. Modern conveniences, such as remote work and online entertainment, have made sitting an inevitable part of life. Unfortunately, the human body wasn't built for prolonged inactivity, and an increasingly sedentary lifestyle is contributing to the global burden of heart disease. Excessive sitting results in reduced blood circulation, decreased metabolic rate, and insulin resistance, each of which is a risk factor for cardiovascular complications. It also reduces the levels of high-density lipoprotein, HDL, cholesterol, often known as good cholesterol, and raises triglyceride levels, promoting atherosclerosis. A simple yet effective countermeasure involves making movement a priority throughout the day. Experts recommend standing, stretching, or taking a short walk every hour. This consistent movement keeps blood flowing, boosts energy, and keeps inflammation in check. Standing desks are gaining popularity as a way to reduce overall sitting time, while daily tasks such as gardening, housework, or taking phone calls on foot also provide opportunities for movement. The benefits of staying active go beyond the physical. Regular movement helps regulate hormones like insulin and cortisol, minimizing stress, a significant contributor to cardiovascular strain. An active lifestyle also helps maintain a healthy weight, which reduces the risk of developing metabolic conditions that can place added stress on the heart. Pharmaceutical interventions are often life-saving, yet the indiscriminate use of medication can introduce unintended health challenges, particularly for the cardiovascular system. Overusing medications such as statins or nonsteroidal anti-inflammatory drugs, NSAIDs, can have adverse side effects that may ultimately strain the heart and blood vessels. An alternative approach that is gaining traction is using natural remedies under the guidance of healthcare professionals. For instance, omega-3 fatty acids, known for their anti-inflammatory properties, can be used as a natural alternative to reduce heart inflammation. Coenzyme Q10, CoQ10, a powerful antioxidant, supports mitochondrial function and helps alleviate statin-induced muscle pain while promoting heart health. It is also essential for individuals to engage in regular discussions with their healthcare providers regarding their medications. Often, lifestyle changes like dietary improvements, increased physical activity, and stress management can help reduce dependency on pharmaceutical solutions, promoting a more natural way of maintaining health. Late-night snacking has been widely regarded as a comforting ritual, yet the effects it has on heart health tell a different story. The body follows a circadian rhythm, which governs sleep-wake cycles as well as various metabolic processes. Eating late at night disrupts this rhythm, hampering the body's ability to metabolize food efficiently. This results in elevated blood sugar and insulin levels, hindering the body's natural fat-burning processes and increasing the risk of weight gain and type 2 diabetes. both of which are major risk factors for heart disease. To maintain the integrity of the body's circadian rhythm, experts recommend setting an eating cutoff time, ideally 2 to 3 hours before going to bed. This gap allows the body to focus on restorative processes, such as repairing cells, rather than digesting food. Additionally, establishing healthy alternatives for late-night cravings, like herbal teas, can make the transition easier for those accustomed to snacking before bed. Hydration is key to maintaining a healthy cardiovascular system, yet like most things, it needs to be approached in moderation. Drinking large amounts of water in a short period, especially when on a low-salt diet, can dilute sodium levels and lead to hyponatremia. This condition, characterized by low sodium concentration in the blood, can impair cardiovascular function and lead to symptoms such as confusion, headaches, or even life-threatening complications like seizures. Electrolytes, which include sodium, potassium, calcium, and magnesium, are essential for heart health as they regulate the body's fluid balance and help control electrical impulses that govern the heartbeat. Consuming electrolyte-rich foods, like bananas for potassium, nuts and seeds for magnesium, and moderate amounts of salt, supports the delicate balance needed for proper hydration. The emphasis should always be on consistency and moderation. Rather than guzzling down water in large amounts at one time, it's advisable to sip water consistently throughout the day and adjust intake based on factors like temperature and physical activity. Oral health is often overlooked in discussions about heart health, but research increasingly points to the interconnectedness of the two. Poor dental hygiene can lead to periodontal disease, a chronic infection of the gums, which allows harmful bacteria to enter the bloodstream. This, in turn, can trigger systemic inflammation and promote the formation of arterial plaque, increasing the risk of atherosclerosis and cardiovascular events such as heart attacks. Good dental hygiene practices are thus essential for maintaining cardiovascular health. Experts recommend brushing teeth at least twice a day, flossing daily, and using an antibacterial mouthwash to minimize harmful bacteria. Regular dental checkups and professional cleanings are also key components of oral health maintenance. Breathing is an automatic process, yet how we breathe can significantly impact our health. Mouth breathing, especially during sleep, has been shown to disrupt sleep quality and oxygen intake. Conversely, nasal breathing helps filter, warm, and humidify the air before it enters the lungs, improving overall lung function and oxygen uptake. Furthermore, nasal breathing triggers the release of nitric oxide, a molecule that helps dilate blood vessels, promoting better circulation and lowering blood pressure. Individuals are encouraged to practice nasal breathing both during the day and while sleeping. This can help improve sleep quality and, subsequently, heart health. For those who struggle with mouth breathing at night, mouth tape may be recommended under the guidance of a healthcare provider. Microplastics are pervasive in the environment, making their way into the food we eat, the water we drink, and even the air we breathe. Alarmingly, recent studies have found microplastics in human blood, raising questions about their impact on health. Microplastics can contribute to systemic inflammation, which in turn places additional stress on the cardiovascular system. Reducing exposure to microplastics is essential for protecting heart health. Simple steps such as avoiding single-use plastics, storing food in glass or stainless steel containers, and filtering drinking water can help limit the intake of microplastic particles. Opting for natural fiber clothing can also reduce the shedding of plastic microfibers into the environment. Exercise is a cornerstone of cardiovascular health, but pushing the body beyond its limits can lead to unintended consequences. Breathlessness during mild or moderate exercise may indicate an underlying cardiovascular problem, such as obstructed arteries or a compromised heart valve. To optimize heart health, individuals are encouraged to gradually increase exercise intensity and listen to their body's signals. Any sign of extreme breathlessness, dizziness, or chest pain should prompt immediate cessation of activity and consultation with a healthcare provider. Regular cardiovascular checkups, especially for those with risk factors like hypertension or diabetes, are important for ensuring the safety of an exercise regimen. Traveling, particularly across time zones, can disrupt sleep patterns and create fatigue, both of which can impact cardiovascular health. Supplements like niacin and vitamin D3 can be useful for maintaining energy levels and regulating the sleep-wake cycle during travel. Niacin helps improve blood circulation, while vitamin D3 plays a crucial role in mood regulation and maintaining bone health. Individuals are advised to consult their healthcare providers to determine the appropriate dosage before incorporating these supplements into their travel routine. Cardiovascular exercise is fundamental for maintaining heart health, but overdoing it without adequate rest can lead to elevated cortisol levels and increased strain on the heart. While cardio exercise strengthens the heart, overtraining without adequate recovery can lead to burnout, hormonal imbalances, and weakened immunity. To avoid these pitfalls, rest days should be an essential part of every exercise regimen. Balancing cardio with strength training and flexibility exercises such as yoga or Pilates can help maintain overall fitness while supporting recovery. Rest days are critical for allowing muscles, including the heart, to repair and rebuild. Exposure to secondhand smoke is a well-known risk factor for heart disease. Even brief exposure can damage the lining of blood vessels, leading to the formation of plaques and atherosclerosis. It is imperative to avoid environments where smoking occurs and to advocate for smoke-free public spaces. While the dangers of active smoking are widely understood, individuals should be equally vigilant about protecting themselves from passive exposure. In closing, adopting these heart-healthy habits can profoundly impact your cardiovascular well-being and overall health. By prioritizing sun exposure for vitamin D, breaking free from sedentary routines, using medications wisely, managing your eating patterns, and maintaining good dental hygiene, you set the stage for a healthier future. Remember, it's not just about avoiding risks. It's about making proactive choices that nourish your body and mind. From breathing through your nose to minimizing exposure to microplastics, every small change can lead to significant benefits. Listen to your body during exercise, balance activity with rest, and be mindful of the environments you expose yourself to, especially when it comes to secondhand smoke. Thank you for joining us on this journey toward better heart health. If you found this information helpful, please like, share, and subscribe for more tips and insights on wellness. Together, we can build a healthier community, one habit at a time. Until next time, take care of your heart and stay healthy.